Hi everyone, I'm Will Snyder. I'm the co-founder and CEO of Metopio. Metopio is a analytics and SaaS software developer here in Chicago, Illinois, and our technology is what powers the Chicago Health Atlas as well as the Cook County Health Atlas. And we're excited to have you use it. Hopefully it's easy to use, it provides incredible insights for you, and we also want your feedback. So as you get in there and work and discover unique insights about places and populations throughout the Chicagoland area, as you have ideas for ways that it can be improved, please send them our way. But just wanted to introduce today you to what the technology is and what the platform does. So Chicago and Cook County Health Atlases do three things. They provide curated data, they provide the ability for users to analyze that data, and then they provide easy ways for you to visualize and export that data to use in articles, on websites, PowerPoints, presentations, and elsewhere. So we'll start first with the data curation. So the Metopio technology is able to ingest thousands and thousands of data sets, millions of data points from all different sources. Predominantly though, the sources of data that you'll find on the health atlases are from either Cook County or Chicago, specifically in Chicago, the Healthy Chicago survey. But we also add data from the Centers for Disease Control, Housing and Urban Development, the EPA, the American Community Survey, also known as ACS or the Census, and a variety of other sources. All of that is so that you can have a multivariable understanding of places and populations around Chicago and Cook County. That data updates automatically as it's updated at the sources. So if you need the most current, the most timely data for any number of topics that are on the Health Atlas, that's the place to go. You don't need to go chase them down through open data portals or elsewhere on the internet. You can come to the Health Atlases and be able to find that current frequent data. As journalists, I know you're all very concerned and very focused on the source and the citation that you need to provide for your data and for what you're creating on the Health Atlas platforms. That's very easy to do. We actually have a citation page under the how to use the Atlas. And on that, there are 4 or 5 different ways that you can understand how to cite the data that you are using while on the Health Atlas. So we want to make sure that you can, as quickly as possible, get the insight that you need and then know how to present it to your audiences. So the second thing that we do, in addition to data curation, is we allow users to analyze that data. We do this through a number of different visualizations or interfaces. So you can create tables, charts, maps, and actually use a scatter plot, which has a regression tool built into it, to be able to understand the relationship between different topics at different levels, geospatial levels around the city of Chicago, Cook County, the suburbs, and municipalities in Cook County. The last piece is you can visualize all of that and customize those visualizations. So from start to finish, you can come into the Health Atlas, get the information that you need, find that data source, see what it looks like based on the question that you're trying to answer for your audience, and then create powerful visualizations, whether they're maps, charts, tables, or scatter plots, customize the colors, customize the look and feel, the presentation of that data, download it from the Health Atlas, and then use it wherever you are building your story or communicating with your audiences. So we really want this to be a start to finish process for you, to be able to help you in your work, be able to get the answers to the questions that you're working on through the reporting work that you're doing for your publications. So again, thank you so much for using the Health Atlas. Excited to see what you're able to produce with the data and the tools that we've been able to build in partnership with UIC, the City of Chicago, and Cook County.
Hi, everybody. This is Nick Prashant. I'm the Director of Epidemiology for the Chicago Department of Public Health. And I want to thank you for attending this training today. The Chicago Department of Public Health has been involved in the evolution of the Health Atlas for over 10 years. And we're so happy that the evolution has brought us to this point of partnering with great partners like Metopio, the UIC School of Public Health, and now newly the Cook County Department of Public Health in this effort to make data available to the public and to all of our public health stakeholders, including members of the media. So the Chicago Department of Public Health is committed to improving health by helping residents, communities, and partners, including you, to understand and access, and most importantly, use our data. We are very committed to a sort of data to action philosophy, and we don't produce and present data just merely to admire it or to gawk at it, but rather to use it to help, ultimately help and benefit our communities. We're committed especially to helping the media report accurate, reliable, timely, and most importantly, respectful of our data that's respectful to our communities and their many diverse populations. So I want to take you a little bit inside the health department to help you understand how this data gets ultimately to you. And there are a number of things that we're doing to make sure that data is disseminated responsibly. The Office of Epidemiology at the DePaul Center, downtown Chicago, is supporting the work of over 50 epidemiologists across the department in various programs that whose responsibility and job is to acquire, process, analyze, interpret, and disseminate data to many different stakeholders. We have epidemiologists working in communicable disease, in HIV and STI, substance use, public safety, mental health, maternal and child health, chronic disease, environmental health, immunizations, and then also in policy and planning. So policy and planning are epidemiologists who are working to develop frameworks and evidence-based goals that will help the health department and its partners create a framework by which to conduct their health improvement activities. So our most recent example of that is the Healthy Chicago 2025 framework, which really helps inform and prioritize the kinds of data that we are encouraging you to use. When you look at the Atlas, that's only the first stop in our sort of commitment to making data available. We also have recently rolled out a public data request and data feedback form that you can see the link and screenshot here on the slide. And this data request form is for when you or your partners or the public has questions that the Chicago Health Atlas can't answer, or you need deeper or more refined information than the Atlas can provide. This form takes the data request into an automated system that triages the request to one of our 50 epidemiologists for completion. And so in this way, we can track, monitor, and assure that people are receiving data in a timely manner. So when members of the media request data through this form, we will route it initially to our public information office for review, and you will receive an immediate feedback from the public information office as well as our data team that we've received and whether we need more information about your request. I also want to remind folks of other data resources that the City of Chicago manages, including the oft-used COVID-19 data dashboard and all the other auxiliary COVID-19 data that the city has worked to produce. Moving forward, we'll continue to maintain those data sources. There's also the Chicago Data Portal, which is a City of Chicago managed portal that produces and displays data across a wide variety of topics, including things that are related to business licenses, CTA ridership, crime, park district facility information. It runs the gamut across the city. And of course, also to remind you that CDPH does manage your health-related FOIA requests, and many of you are probably familiar with that process, but I have listed the email for you here. So in that way, I wanted to just emphasize that there, when you do utilize data, whether it's through the Atlas or through our other city resources, we are committed to providing data in an accurate, timely manner. And we are really encourage you to reach out and work with our team to make sure that you are reporting the data in a way that is most accurate and most helpful. And we support you in this effort, and we hope that the Chicago Health Atlas and its continued improvements will continue to serve you well.